Now we move on to one that's a little bit closer, given the story I gave. We're moving on to prostate cancer. If we can play the first video to tell us what prostate cancer is about.
Went in last year for my annual physical, and they do the blood work. And you know, there are a number of different tests that they do in the blood work, but one of them is the PSA.
Oh, I might have given you the wrong video.
But I really thought he was overreacting because I have no symptoms. I never felt bad. I never had any problems with the plumbing, you know. 6 of the 13 biopsies that he had taken came back positive.
Bill was diagnosed with intermediate risk prostate cancer, which is the #1 cancer in men. Options for prostate cancer vary depending on the clinical stage, the diagnosis, patient's risk factors. Common treatment options would be active surveillance, radiation therapy, or surgery, which could be done via open or robotically.
The amount of information you get is at times a little bit overwhelming, but it's really appreciated. You know, you really have to digest what you want to do.
It is very important that we come to a decision together, and having a long conversation with the patient, his family, if the patient wants the family there.
So then my wife and I came home, we said, okay, these are the pluses and minuses of each of these courses of treatments, and we decided to go with the surgical option.
Robotic surgery, unlike open surgery, benefits the patient in less blood loss, earlier convalescence time. Bill, after the procedure, did very well. His surgical margins were negative, meaning that there was no cancer seen at the margins of where we cut the prostate. He has a terrific prognosis.
There's no reason to believe that life just doesn't go on now, you know, and you know, we're very thankful for that. That's extremely important. You know, we just retired a couple years ago. We got a lot of travel plans ahead of us, and you know, we can do them.
Yeah, there we go.
All right, so I actually had another video which I was going to send Cypher, but I stuffed up. I didn't send you the link for it to explain what prostate cancer is. That's about this guy's journey and the PSA test, which I'll talk about in a minute. The prostate is a gland you have, men have, of course, that produces, well, I'm not sure if it's actually semen. I don't think it produces the fluid that sperm swim in, not the semen with the sperm as well. Hopefully Dr. Chuck will correct me if I've not quite got that right. It also produces the antigen, which is what the PSA test tests for, the prostate-specific antigen that enables the sperm to penetrate the egg during conception. So that's what the PSA test picks up. They back in the 70s they did blood tests, and it was for forensic analysis of a crime scene, and they figured out that they didn't realize PSA was in the bloodstream until that point. And they discovered that a perpetrator who was a male happened to have PSA in his blood. So until that point, they didn't know it was in the blood, so that they could use this as a test to determine, you know, whether it was male or female for a start. But the PSA is basically just the antigen leaking from your prostate into your bloodstream. So if that raises, that's usually an indication, or it's a possible indication, Dr. John, that you might have something happening with your prostate in terms of a tumor, or at least it's not functioning properly. But it's not a reliable test because there are other things that can raise the level of PSA in your blood, like sexual activity, for example, and a few other things. The best test, as some people in the chat have mentioned, is the finger up the bum test. An experienced urologist will know what a healthy prostate feels like. And they're not doing it for any jollies. They're doing it quickly, and they're just doing it for the purpose of figuring out what your prostate is like. And, you know, it's probably the most embarrassing test a man could get, but he's a professional, or she's a professional. Let him do it, and then it's done, and at least you'll have a much better idea than just the PSA test alone of whether or not you've got cancer. That's worthwhile putting up with a finger up the bum about. I've only had it done twice to me, and I'm not looking forward to another time. And the best way of testing is getting an MRI, which is what I'm getting tomorrow, to confirm whether or not I've got any issues with my prostate. From what the urologist tells me, I probably don't, which is good news. And that's what I'm looking forward to. And maybe my genes are more from my mother's side of the family rather than my father's. So who knows? Hopefully that's the case. And we'll move on with my life as a result. But
That's right.
I feel like I'm living in fear of prostate cancer given my family history, but we'll see. And it'd be good for my sons, if they, for their future as well. If I show that I don't really have this issue with prostate cancer, then that'd be awesome. But I won't know that until I'm very old, I guess.
No, that's right.
Right, so-
It takes a long
Yeah, go on.
time to even be start figuring out that there's something wrong. And you may go for a test and then, have something go wrong a week later and it starts up. So, as you said, constant checking is important.
Well, that video we just saw demonstrates that very clearly. It's if you catch it early, prostate cancer is really good.
Yep.
You have really good prognosis.
Yep. And a good chance of surviving too.
Yeah, it's very typical to fight prostate cancer for 10 to 20 years. So it's not a death sentence, and it's not an immediate death sentence by any means, but it will get you in the end eventually if you leave it untreated. So it's best to catch it as early as you can and get your yearly PSA test to at least get some indication of whether or not there's an issue. And if you get high results like I did, you get sent to the urologist who sent you for an MRI, and that way you know for sure. It's not a lot. It's bulk billed too, the MRI. So, I had to pay the urologist $130 odd that Medicare didn't cover. So it's not a very expensive thing, it could give you 20 years to your life, which that's a bargain, I would have thought.
Yep. And speaking of the MRI, the next video is on that.
Yeah, just before we go into that though, this demonstrates that the treatments, usually the treatment, at least when my dad was around, was surgical removal of the prostate. Now, the risk of that, about 50% of people who get surgical removal of the prostate that have become cancerous, well, first of all, you get secondaries. Dad got a secondary on his brain, which is almost unheard of, and he had to have brain surgery to have that one removed. So he was just very unlucky. But also, removing the prostate can reduce your erectile function, you might say.
Yes.
And you're usually given an option. Dad, you can remove some of the prostate and remove all risk of losing the erectile function, or remove all of it and run that 50% risk of losing the erectile function. Dad went for the first option, removing some of it, and he didn't lose his erectile function, but the cancer came back, and that's what eventually killed him. His brother, who's 5 years younger, and got prostate cancer at exactly the same age, Dad said to him, "Get the bloody thing out." And so he had it completely removed, and he's still alive with no problems. So that's advice worthwhile giving to people.
Yep, absolutely.
Yeah. You got anything to say, WhaleLord?
Pardon?
You got anything to say?
Oh, not really. I'm not
No? All right then.
really experienced in the subject, but
No,
Hey.
you'll on the next one you'll have a lot more to talk about. So this next video is about the new treatments for prostate cancer. This is worthwhile having a listen about.
John Feller. I'm the Chief Medical Officer for Halo Diagnostics. And I'd like to talk to you a little bit about a new type of therapy called focal therapy for prostate cancer. The standard of care for detecting prostate cancer currently includes getting a screening serum PSA followed by a multiparametric MRI in patients with an elevated PSA, and in patients whose MRI is abnormal, then having an MR-targeted biopsy of the prostate. In a subset of men who have clinically significant prostate cancer, confirmed with these standard of care detection techniques, they can go on to image-guided focal therapy. In our case, we do MRI-guided laser focal therapy. This is done under an IRB-approved clinical trial, so it's not yet considered the standard of care and is not reimbursed by insurance. but is being performed for investigational purposes. We at this point have 10 years of follow-up in almost 200 men, where in an outpatient setting, we've used MRI-guided laser focal therapy to safely and precisely treat prostate cancer that's intermediate risk and is confined to the prostate gland and hasn't spread anywhere else. Now you may ask yourself, well, what is the advantage of this MRI-guided laser focal therapy? The big advantage is that our cancer control is very, very similar to if the man had whole gland therapy, such as radiation therapy, or surgical removal of the prostate gland, which is called a radical prostatectomy. But the patients who have whole gland therapy are at significant risk of getting side effects. Up to 50% of them can get erectile dysfunction, and up to 25% of them can get urinary incontinence. In the 10 years that we've been following our patients that have had MRI-guided laser focal therapy, we have not seen any statistically significant erectile dysfunction or any significant urinary incontinence. So the bottom line is, with this new type of MRI-guided laser focal therapy, we can safely treat some forms of prostate cancer, have similar cancer control to if the patient had the prostate surgically removed or had radiation therapy, but at the same time we eliminate the side effects of whole gland therapy. No erectile dysfunction, no urinary incontinence.
Making Dr. Chuck a moderator so he can post a link to the book on the pros and cons of PSA testing, because he was trying to. But you can't do that unless you're a moderator.
No, that's right, unless you have a wrench.
Yep. So gave him that. All right, cool. So yeah, that so if and when I get to prostate cancer, or anyone else does, that MRI technique will greatly improve my chances of maintaining function afterwards, and be more likely to get the cancer itself, which is, you know, win-win both ways. It's exactly. A really awesome idea. Yeah. So there's nothing left to do but cue the corgi.
You're despicable. Hugh Jars says, I love Hugh Jars and I cannot